You and your doctor.
The content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
And as always, you can find the website. You can check them out at All County Healthcare or give us a call right here at the studio at 888-994-4995. You definitely want to get your pencils and papers and put your ears, as they used to say in school, in check, because we've got a lot of great information for you. NYU Langone is in the house right here in Palm Beach County, which is unbelievable. And if you're anywhere in South Palm Beach County or anywhere in the area, you definitely want to take a listen to this. We've got David Selzer joining us of NYU Langone. He is an internist, also working within the area of obesity medicine. We have Shauna Meckler, registered dietitian, and Deborah Lifshitz with us, a licensed clinical social worker. So let's get right into this conversation with Dr. Selzer. Welcome to the show.
Thank you. Thank you so much for having us.
It is a pleasure to have you join us. Tell us a little about your practice.
So we started our practice around 5.5 years ago. We came down and we opened up NYU South Florida. We have 2 offices, one in Delray Beach and one in West Palm Beach. And we've grown it organically. There was a cardiac division that was already in place, and we grew the internal medicine department. Over the years, we have been focusing on nutrition and wellness in order to help prevent progression of disease. Our goal is to help people come up with a new lifestyle in order so that they will be healthier going forward. Our main objective, especially in the Delray Beach population, which is more curved to an elderly population, is to make the retirement life as good as well as possible. We realize that people have worked extremely hard to get to this stage of life. They've worked for years to be able to enjoy, quote unquote, their golden years, and we want to make them as healthy and as happy as we can. So we focus on prevention in order to help patients have the best experience that they have in the South Florida region.
And I have to ask, you're with NYU Langone. You really brought the whole area of internal medicine to fruition with this. What makes this office and your practice through NYU stand out from anyone else?
Well, I'll speak first for a moment in regard to our snowbird population that are affiliated with NYU, in that we have direct connections between our office and our office in New York. It doesn't matter per se if they are in Delray or West Palm Beach or somewhere in Brooklyn or Long Island or New York City. All the information is there. One of the biggest problems that patients have is, well, what is your background? What is your information? Have you had an echo? Have you had a stress test? Have you had any of the basic imaging that was done previously? Patients are obviously frustrated. Costs will have to skyrocket if you have to repeat data, and trying to get records from other physicians till you get that information when that information is needed right away is a problem. So when we are linked and we have all that data right in front of us, the clinical decision making becomes that much more keen and insightful when you have all that information right in front of at your fingertips. I believe NYU is an amazing institution. I've worked for them for over 5 years. I've had great success working with them. All the clinical needs that a patient could have and all the consults that would possibly be needed are part of the NYU facility, and we can easily connect ourselves with our New York colleagues in order to optimize care for patients.
And that is critical, especially when you're coming down to here when it's snowbirds and you're here part-time. You don't think about bringing your records down. You slip and fall. You need an x-ray, but you've had a previous x-ray someplace in New York. You can get right into the whole system and pull it, which makes it easier, the quality of care, the continuity. It's just smoother. And for your kids that are here or your kids that are in New York, you know that your parents are well taken care of.
Yes.
But it's not just you, and it's not just a team of internal medicine physicians. You have a full care staff with you. And we've got a couple with us here. Tell us about your care team, as you call it.
So I'll start at the physician level. We have 4 internists. We also have nurse practitioners, and we have cardiologists that are all part of the team. We also have an endocrinologist and an OBGYN. So with that noted, we're also trying to add more and more specialties as time goes on. We're trying to add neurology, and we're trying to keep ourselves growing. We're trying to add a hospitalist. So all that is sort of our base. Then in addition, we have a nutritionist, we have a social worker, we have a physical therapy team in order to provide a most well-rounded care for patients.
You talk about preventive medicine, and I know diet, exercise, nutrition, and mental acuity mindset. Mental health right now is critical for everyone to put all these pieces together. And I see your program is really bringing it all together. Where do you start? They come in, you do an assessment, and you say, all right, let me send you to Deborah or Shauna, and let's start with that. What's the process?
So process is, let's take the typical 45 to 70-year-old patient that comes in. They say they have, let's say, a level of diabetes or kidney disease or obesity. And our approach is we're here to make sure that this does not progress. We're here to make sure that you can get healthier faster. We want to make sure that you are being treated from a whole body approach and that we are making sure that you are healthy. So depending on what their long-term goal is and what their comorbidities are, we try to come up with an entire plan. So we're going to focus on their mental well-being. We want to make sure that nothing can get done if their mental health is not there. We need to make sure that they're in a proper emotional and mental state in order to get healthier. So that our first step is, hey, do you need to work with a social worker? And I think over time, people have become more and more accepting of mental health treatment than they were 10, 15 years ago.
I was going to ask you that, right? So you deal with the senior population, and it's hard to accept change. Yeah. So you've got a new patient, they walk in, there's so many questions I have. You've got someone that maybe has diabetes, right? Base type 2, so they're overweight, maybe you're going to classify them obesity. Now the mindset is we now need to change your lifestyle, right? You're not going to go on a diet. We need to change your lifestyle, and we need to change your food choices. So here brings in your whole team approach.
Okay.
Who starts? Shauna, do you say, let's take a look at your nutrition, your dietary guidelines. Let's look at this.
Yeah, so I start with looking at their blood work because I can weigh them on the scale, but I can't really advise them on a diet unless I see them, from the whole body approach. So I'll sit with them and I'll take their intake, get their lifestyle, exercise, nutrition habits. And like you said, it's hard to get people to change after 50, 60, 70, 80, even 90 years.
No, it doesn't take a day to get there, right?
Right.
It's a lifetime.
So then I give them a rating. I have them rate themselves. How much are you willing to change? How important is this to you? Because then I know what I'm working with. And then I'll start to give suggestions of, I think you would do well trying this out. How willing are you to try it? And I have them set small, realistic goals from session to session so that it's not changing everything overnight.
And then we go to Deborah, because 60 days into it, right, we're gung-ho, we're losing weight, and we're getting on the scale, and you're coming in, and then suddenly you plateau. Your blood sugar changes, and maybe you get a little depressed. Maybe you want to have dinner with your friends, but they're going out for Italian food, but Shauna says, you can't have that. They come see you, Deborah, and you help with what?
Well, I always start with, it's called a psychosocial. And basically what we do with a psychosocial, I say, it's kind of like getting a little history. Like when you go to the doctor, they got to get your medical history. Well, I need your social history. Where are you from? What did you do? Was there any substance abuse history? What about substance abuse in your family? 'Cause that can really add a lot of stress and cause a whole range of situations for our patients. Kind of looking at that, finding out a little bit what they like to do, what they're interested in, a little bit about their family. And then we kind of make a plan of what they want to talk about, what their goals are for therapy. Obviously, they have to be realistic. And then we kind of work through those internal, external barriers that prevent them from losing weight. It could be depression, it could be anxiety, it could be a conflicted relationship.
Then you've got the endocrinologist, right? Then you look at that, whether it's a thyroid problem or diabetes. You have this great multidisciplinary team approach for all of your weight loss.
Yes, our goal is to find out, is there anything that is preventing the person from reaching their optimal health? I think it's important to focus on people's weight, but it's also important to focus on people's health. It's not just about a number on a scale. It's about how do we control your entire body? How do we take a whole body approach so that you're happy with who you are and what is your overall well-being? It's not just are you 220 versus 210. It's about how do we make sure that you are living a well-balanced, healthy lifestyle. And that's not just take a pen and inject yourself with a medication. It's coming up with a true wellness approach to care for the patient.
And what are you finding about behavioral therapy when the patients come back and see you and they come for a follow-up and they've been working with your team? Overall, you're seeing what?
Overall, I'm seeing an improvement in wellness. Overall, I'm seeing that the patients are happier and healthier, and that's our goal. Our goal is that they feel more comfortable in their own skin and that they feel that their health is much better. I think that the more you try to tap into people's emotional wellness and their mental health, the better the patient is going to feel overall. It's not about how many meds you can put the patient on. It's about how many years of happiness you can give them. So we believe in the mental approach, and we believe in the nutrition approach, but there's also physical therapy. We get our patients moving. We get our patients feeling better about themselves by exercising more, getting them into a more well-balanced and healthier lifestyle.
I feel like this is cutting edge because I have not really heard of any other medical practices that using this multidisciplinary approach within their own office. And you can maybe see your physician and he says, all right, I can refer you to this office for mental health. I can refer you to a dietitian and she's somewhere else. You can go over to this x-ray center. You can go here to the endocrinologist, but you have it all under one umbrella.
Well, that is a credit to NYU and my bosses that really take care of the whole office. They're the ones who are really making sure that everything's taken care of, and that's NYU's motto. We want to make sure that the whole patient's taken care of, and we want to give top 10% an amazing care to all our patients that walk through the door. We want to make sure that they know that when they have the NYU brand and NYU physicians, that they are well cared for.
Before we go to commercial break, I have to ask, Shauna, as far as dietitian goes, it's a couple, husband and wife. She's been cooking however many years, a certain way. Clearly they are where they are. Do you work with the couple or the extended family on food changing, food plans, food choices to benefit everyone?
So if the couple comes in together, most definitely. I often see like the wife come in and she's talking for the husband. And I'm like, let me get information from the husband and then I'll talk to you about how you're going to prep his meals kind of thing. So I just straight shoot and tell them how it's going to be. Oftentimes though, the husband will come in without the partner. And then I say, take this home to your significant other. And if they want to come in next time, let them come in so that they can get a better idea of what's going on with you.
You will encourage them to come in together, which is really nice approach, again, for the mental health component of it, because now you're coming in together as the family unit saying, we're not just one, right? This is the family, however big the family is, and you're going to work with them as a whole.
Yeah, definitely.
And can you help them? Different dietitian is different than nutritionist? How?
So anybody could self-declare themselves as a nutritionist. A dietitian goes through coursework and it could be a year or 18-month internship program, similar to like a residency, where you do different rotations in different areas of dietetics, and then you have to sit for a registration for an exam, and then you have to pass the exam.
You can sit and do menu planning, all different, because some nutritionists can't do that. They say, we can recommend a plan, but we can't go into the specifics.
Right.
With your licensing and training, you can go into the specifics of what a cardiac diet is, what a diabetes
Exactly.
diet looks like.
Yep. So I can calculate their calorie needs, protein, fat, carbohydrates, etc.
You take the guesswork out,
Yep.
which is what we need. All right, we're going to cut to a commercial break. If you have any questions, give us a call right here at the studio, 844-4995. Right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to You and Your Doctor, sponsored by All County Healthcare. You can check out their website, All County Healthcare. You can also give them a call, which is a whole lot easier, 954-717-7027, 954-717-7027. We are here tonight with Dr. David Selzer, Shauna Meckler, and Deborah Lifshitz, part of their quality care team at NYU Langone right here in Delray Beach, which is a full-service medical facility, internal medicine, dietitian, endocrinology, you name it, they have it, mental health counseling, and on and on and on. So we've got a few more questions to get to. Accountability. We've talked about your whole team approach. We've got dietitian, we've got mental health. They come in and they see you, but they can't come see you every day. So we're looking at weight loss. There's got to be a remote way to monitor your patients. You call it RPM, remote patient monitoring.
That's correct.
You tell me they go home with the Bluetooth scale. Does that get hooked up to your office? How does this work?
Right. So they come in, I set up the Bluetooth scale to their iPhone or whatever smartphone they have. I then connect it to our electronic medical records. I tell them to weigh themselves every day. And then once they weigh themselves and they sync it through Bluetooth, it pulls up on my screen when I run my report daily. So I can see where their weight is going. Is it going up? Is it going down? If it's really great because then I get to call them in between their visits with me or with Deborah or with Dr. Selzer, and I get to check in and say, how's it going, weighing yourself? And they'll come back and say,
I would never say good if that was actually a question. Dawn,
yeah.
you want to get on the scale? No.
And oftentimes they'll be like, oh, well, it's been so bad. And I'll say, well, I'm looking at the number and like, compared to last time, yeah, you went up a little bit, but imagine if you weren't weighing yourself every day.
True.
How much more would you weigh?
The accountability of it.
So it's really important.
It makes a big difference. And everyone's going to say, all right, what's this going to cost me? How can I see the doctor, Medicare, insurance, but now I've got this whole team approach. Is all of this covered by insurance and Medicare and supplements?
So,
a good question for you.
in regard to any patient that has diabetes or chronic kidney disease, they are definitely eligible for nutrition consults, which is very important because the healthier you get those people, the less likely they're going to progress. And the last thing we want somebody who's a diabetic who has kidney disease is to end up on dialysis. So we want to prevent that. So that's why we're going to have them see the nutritionist. In regard to depression, most Medicare plans will be able to allow someone to be seen by a mental health professional. Most Medicare plans do cover social work therapy. In regard to remote patient monitoring, Medicare definitely covers as long as you have two Medicare, enabled diseases and your obesity level with a BMI over 30, and they'll cover remote patient monitoring in regard to a scale. Other things that you can use are blood pressure monitors, and those will also all be covered under remote patient monitoring.
So there is no worries about being able to afford it. If your kids are listening, mom and dad have Medicare, and they've got maybe have some of these, just let them go in for a consultation, schedule a visit, and they'll let you know what's applicable and what does not.
We also have a nursing team behind us and our administrative staff who are geared in order to be able to work out the kinks in regard to insurance and how to quote unquote document it in the best way in order to get the most coverage. So I always say I'm a physician, not insurance, but we do try to work with the patient. We do try to make it that we can get the most out of their insurance coverage, and we have specialists who work on that in order to try to get the most coverage and to be the most affordable for patients.
I got to tell you, I love the whole multidisciplinary approach. As my parents are aging, and they're in Fort Lauderdale, the only place they go is to the doctor. And every day, it's here, it's here, it's here. And finally, I said, Mom, will you go here? She says, no, I'm done. I cannot go to any more offices. But you have it all in one, and you share information. The hardest thing for them is they got to take the information from one to another, find the scan from here. You all make it so easy. And then what that does, it's depressing, right? All you do is go to doctors. All you do is complain to your spouse. But now you've got the mental health component, and you tell me in crisis, you're there. Someone can pick up the phone and say, I really need to talk to someone right now, and here you are.
I always say to my patients, you're not alone. You're not alone in whatever you're going through. And I think, when we're in it, whatever it is, we get so caught up in our head and we go down this really dangerous rabbit hole. So knowing that you're not alone, knowing that there's someone on the phone who really cares and really wants to help you is great. So they can see me telehealth, they can see me in person, come in, let's sit in my office and let's talk about it. And we're going to work it through, and you're not alone.
And what about grief counseling? We're talking about an elderly population. People pass away. Can you help? Are you there? My spouse just passed away. My spouse is in hospice. Can you help me, Deborah?
Yes. Unfortunately, through COVID, through all the changes that are going on in our society, people need support during that really, really difficult time, and I am there to support them and talk about it. And there's never, people are intimidated by a crying person. I find it cathartic and helpful. So let's talk about it. Come and cry. I got tissues. It's all good.
But how nice is it to have one phone number, one general number that you can call NYU Langone and Delray or West Palm Beach and say, this is where I'm at. You don't have to flip through your phone or go through your paper phone book, whatever you have, and find your internist, your dietitian, your cardiologist. It's one phone call. It makes it so much easier for the kids, for me and my age. I can pick up one phone and say, all right, this is where I'm at. Can you give me a list of my parents' meds? This is where they are. What hospital are they going to? And it's all in one place. That, I think, in my mind, is a huge benefit of a multidisciplinary approach.
Yeah, definitely. The more services you have under one roof, the better it is. And we also try to make it that patients can see multiple providers all on the same day. We work as a team, so people sort of travel together. If I'm in Delray, I'll have similar staff with me, and when I'm in West Palm, I'll have similar staff with me. So we all work together, and we all know each other very well. We know that we can schedule a patient with me at 8, and then our nutritionist, our physical therapist, our social worker, all together. So this way, you don't have that, we decrease all of that waiting time.
All right, and a best number to reach the office?
561-365-3000, 561-365-3000.
Well, thank you so much, Dr. Selzer and Shauna and Deborah. This is an amazing opportunity for your parents, for your loved ones, for you and your spouse. give them a call. And of course, for all of your home health needs, pulmonary or anything else you need, contact All County Healthcare at 954-717-7027. Have a great night, everyone, and we will see you next week.
Thank you for letting